I'm here with Dr. Weinstein at A.S.A.P.S 2019, and we're in New Orleans, and I'm going to ask him a few questions. So we'll start off with the easy one. What's your favorite color?
Avocado green.
Why is that your favorite color?
I love nature. I love the trees when they come in the springtime, and it's just always been my favorite color.
Awesome. All right. So next question. What is your favorite quote?
My favorite quote comes from an attending plastic surgeon I work with, Dr. Dixie, who basically said, "Don't ever operate on somebody you can't make a difference for." And I think that's predominant philosophy I follow in my practice is I never operate on someone who I think I can't make a difference for them. You know, even though they may ask me to do something, I may not do it because I don't feel that they would benefit from what they're asking me to do. For me, it's not about the procedure. It's about the individual, and it's about the results, and it's about the aesthetics of what I'm doing. I'm not interested in doing tons of procedures. I'm interested in helping people achieve the best possible results that they can.
That probably leads to the next question. Who's your hero?
My hero, well, it's between Dr. Dixie, who was, I went with him to India. He used to go for 6 months a year. I only go for 8 days a year, doing surgery for children and taking care of really bad scar deformities, cleft lips, and difficult nose deformities. I love helping all those people, but probably my childhood hero was Spiderman. So secretly, I'm Peter Parker. But, you know, I try to always do the right thing, you know, which is kind of boring to some people, but, you know, it's my philosophy.
That's great. Yeah, the right thing's the right thing. You were telling me a little bit before we were talking before this, and you were saying that you have a very special Spider-Man copy, right?
I have Spider-Man #1, the original comic book.
The original one.
The original one, and it's like not in fine condition, but I still have it.
That's awesome. Well, do you want to tell us a little bit about maybe your family?
Well, my family, I have 2 children. My son's a producer. He's produced some great films. One of the films he did was a documentary about Dr. Dixie called Flying on One Engine. And I was originally in the film, but I guess I got totally edited out, totally clipped out, which I hope I don't get clipped out on this video, but it's the story of my life.
Promise we won't clip you out.
And my daughter is also a playwright and filmmaker as well.
Wow. That's
so
cool.
I'm very proud of both of them, as well as my daughter-in-law and my new granddaughter, who's arrived December 19th.
Congratulations.
Thank you.
That's
thank
awesome.
you.
Well, thanks for sitting down with us. I appreciate it. Are you looking forward to anything else at the show?
Well, you know, at the Aesthetic Meeting 2019, we started off with a very interesting panel about facelifting. And I do a good share of helping people achieve rejuvenated faces with facelifting or thread lifts, depending upon their needs and what they want. I'm excited about it. And then the second panel today was about breast augmentation mastopexy, which is BAM! And I'm excited about breast augmentation mastopexy, which is one of the things I do quite a bit of. But also mommy makeovers, a very interesting topic that, you know, is very relevant to women who have bodies that have been changed by the fact that they've had children. And the fact is that I can fix the tummy and also contour things and also make the breasts perky again, which is an exciting thing that is achieved. Also, a very new popular procedure is called daddy do-over, because daddies, unfortunately, sometimes gain a lot of weight with it when the women are pregnant. You know, sitting home and not doing the activities they usually do, or watching games all day long. So therefore, daddy do-overs usually involve some liposuction or redistribution of fatty tissue. So we take the fatty tissue, you can put it in the deltoids and the pectoralis muscle and take away that midriff bulge and give them a nice result. As with a woman who we take away the midriff bulge and augment the bottom, the buttocks, we could also do that with a man who's lost his buttocks as well. So there's a lot of exciting innovations in plastic surgery which involve nuances and exact procedures for an individual. It's not about a procedure, bam, you came for this. And also, the other thing is today, a woman has a right to change her mind. So if she has breast implants and she decides she doesn't want her implants, fine, we'll take them out. A year later, she wants to have them back again, fine, we'll put them back in. And I've had that with patients, you know, who decided all of a sudden that breast augmentation wasn't for them, and we took out the implants for whatever reason. And a year later, they said, you know, I don't like the way I look without my breast implants.
Yeah.
And we still have those breast implants available. Recently, the FDA had a panel discussion about whether, in fact, they should have breast implants available. And the Aesthetic Society was very diligent in providing the best possible responses to that, and also in terms of collecting data to prove how safe breast implants really are. And I think I am one of the people who are dedicated to collecting that data. I've been involved with collecting data on breast augmentation patients since 1990, so over almost 30 years. And in that data, we see that the implants are relatively safe products relative to the other things that may be available. And the incidence of significant problems with breast implants are extremely low. And I think that the implants we have today are the safest products we've ever had.
Wow, that's awesome. Well, thanks for sharing some knowledge and a little bit about yourself today. Appreciate it.
Well, thank you. It was a pleasure
Nice
talking
meeting you.